Okay. I have everything then. Okay.
Okay, and whenever you're ready to begin.
Okay. Go ahead and begin now if you want.
Yeah, that's great.
Okay. Hi, my name is Ken O'Riordan. I'm a gastroenterologist at Lutheran General Hospital in Park Ridge, Illinois. I'm talking on behalf of the American Liver Foundation today. Our topic to discuss today is an introduction to hepatitis C virus infection. I have a couple of disclosures to make. I'm both a speaker and a consultant for both Gilead and AbbVie drug companies. When looking at people with viral hepatitis and various different types of hepatitis in the United States, we can look at various different causes for this. Certainly alcohol is still the #1 cause of acute hepatitis in the United States, accounting for about a quarter of patients who are infected with different types of hepatitis. Hepatitis B with alcohol accounts for about 3%. Hepatitis B virus infection alone accounts for about 11% of hepatitis. And hepatitis C virus infection accounts for about 26% of cases of hepatitis in the United States. The combination of hepatitis C and alcohol accounts for about 14%. There are about 17% of patients who have hepatitis, which means inflammation of the liver of unknown cause. When we look at people with viral hepatitis, there are multiple different causes of viral hepatitis and multiple different viruses that cause this, but the commonest types that we see are hepatitis A, hepatitis B, hepatitis C, delta hepatitis, and hepatitis E. Hepatitis A is typically transmitted by fecal-oral route, as is hepatitis E. Hepatitis B is usually transmitted through blood contact and body fluids. Hepatitis C is usually transmitted through blood-to-blood contact, and delta hepatitis requires co-infection with hepatitis B for transmission. Hepatitis A and hepatitis B are vaccine preventable at the present time. In the United States at the present time, there are about 4 to 5 million people who have hepatitis C virus infection. Most of these people were infected in the 1960s through the 1980s. In the 1980s, there were about 250,000 new cases per year. About half of these patients were infected through either intravenous drug use or from blood transfusions or through various other risk procedures. About 75% of people who have hepatitis C have actually not been diagnosed formally with hepatitis C virus infection. And certainly screening people just based on risk factors may miss many people who were infected with the virus many years ago. When we look at mortality rates in the United States over the last 20 years, it is interesting to see that the mortality rate from HIV infection has decreased during that time. The mortality rate from hepatitis B has remained relatively stable, whereas the mortality rate from hepatitis C has shown a small increase. The deaths now from hepatitis C infection, as you can see in this graph, also show that these numbers of hepatitis C up to 2007 were 15,000 deaths per year, whereas the number of deaths from HIV had decreased to about 12,000. Certainly these deaths from hepatitis C are the ones that are reported, and certainly multiple other people may have died from cases that may not be attributable to hepatitis C infection. However, despite recent declining incidence of hepatitis C virus infection, it's thought that the healthcare costs will increase significantly over the next 20 or 30 years due to the complications of patients who are already infected with the hepatitis C virus infection. If you look at the annual cost per person in the household in patients who have hepatitis C versus patients who do not have hepatitis C, you'll see in this table here there's a significant difference between patients who do not have hepatitis C virus infection and what their annual healthcare costs are, compared to at the bottom patients who are hepatitis C positive, who have cirrhosis and who have complications of end-stage liver disease. What are the signs and symptoms of hepatitis? Patients typically complain of fatigue, sometimes a significant loss of appetite. There may be some abdominal pain, some difficulties sleeping. Frequently patients complain of itching, primarily in the palms and soles of their feet, but maybe all over. And frequently patients have low-grade temperatures, joint aches, as well as muscle pains. There may be some yellowing of the eyes, as you can see in this picture here, which is called jaundice, and there may be some change in the color of the patient's urine as well as their stool. Certainly patients who have hepatitis C virus infection have significant problems with relation to work performance, and the instance of sick leave and the instance of short-term disability is significantly increased in patients who have hepatitis C virus infection. And what hepatitis means is that there is inflammation of the liver, and when this inflammation goes unchecked for many years, it can result in formation of fibrous plaques and subsequently result in the formation of scars and nodules, which is called cirrhosis. So on the upper left here, you'll see the appearance of a normal healthy liver. On the bottom part, you'll see what is termed fatty liver, or infiltration of fat into the liver, which often produces a yellowish orange appearance. And up on the right side, you'll see multiple nodules and the appearance of a cirrhotic liver. So viral hepatitis is a condition that can affect anybody, any race, any color, any sex, and does not differentiate between these groups of people. So what are the risk factors for hepatitis C virus infection? Well, certainly a history of intravenous drug use or possibly even intranasal drug use in the past is reported in about half of the people who have hepatitis C virus infection. There is a small risk of patients who have been exposed to multiple other people who also have hepatitis C. There are small risks of hepatitis C infection with tattooing as well as body piercings, small risks with hospitalization as well as some dental work. The risk of hepatitis C infection now from blood transfusions is very, very minimal. There is a small risk with patients who have been incarcerated for prolonged periods of time, but about a quarter of patients who we see with hepatitis C virus infection have no risk factors for hepatitis C. So what is the natural history of hepatitis C? When patients are infected with hepatitis C, very few patients show any symptoms of liver disease. About 20% of patients may have symptoms, but most times the acute infection goes unnoticed. When patients develop an acute infection, unfortunately about 80% of these patients go on to develop chronic infection with hepatitis C, which means that these patients have an infection that continuously damages their liver. About 20% of patients are fortunate and they can clear the virus on their own. Once patients have chronic hepatitis or chronic inflammation in the liver, that over many years can result in scar tissue or cirrhosis developing, and that occurs in about 20 to 30% of patients. And with this, there is a subsequent risk of development of liver cancer at a rate of 1 to 4% per year. Certainly, various different factors do affect progression of the liver disease. So liver disease may advance more rapidly in patients if they are drinking alcohol on a regular basis, if there is co-infection with other viruses such as HIV or hepatitis B, or if there is underlying liver disease prior to infection with hepatitis C. The disease may take up to 30 years or even longer to cause problems in patients who have a healthy liver at the time of infection, in women, and also patients who are younger when they are infected with hepatitis C virus infection. So when we look at the severity of disease, it is helpful in knowing when the time of exposure was, although this may not be always accurately known in the individual patient. Blood tests that are done that can estimate the severity of disease. We can measure liver enzyme tests and look at a test called the bilirubin level, as well as measuring tests of coagulation, which are helpful in assessing severity of liver disease. In the old days, liver biopsy was routinely performed on patients with hepatitis C virus infection to estimate the degree of damage in the liver and decide which patients would be candidates for therapy. Over the last 5 years, there's been a shift towards doing non-invasive testing with blood tests called fibrosis markers, or with imaging of the liver such as fibroscan or MRI scanning of the liver to look for the degree of fibrosis and underlying cirrhosis in the liver. Certain things to remember about hepatitis C is the ways that it is not transmitted. So typically it is not transmitted through casual contact such as hugging, kissing, sharing eating utensils, and sharing drinking glasses. It is not spread by sneezing or coughing or shaking hands or sitting on a toilet seat. There are various different tests which we talked about which your doctors may run for hepatitis C. There is a hepatitis C antibody test that is often the initial test that is run, and that confirms exposure to hepatitis C. However, this test sometimes may be a false positive test. This test also will remain positive throughout a person's lifetime, even if the virus is successfully eradicated with medication for hepatitis C. Blood test that is commonly used for most patients is a viral load, and that tells us how much virus is in the system. And this often helps determine the duration of antiviral therapy. The genotype test is a test that tells us which type of hepatitis C virus infection you have in your blood, and the liver biopsy, as we've talked about before, is being used less frequently at the present time. So who should be tested for hepatitis C virus infection? Well, the CDC recommends that everyone born from 1945 through 1965 should have a one-time blood test for hepatitis C infection. Patients who have ever injected illegal drugs should be tested. Patients who have received clotting factor concentrates before 1987. Patients on chronic hemodialysis should also be tested. Anyone with elevated liver enzyme tests should receive testing for hepatitis C, and also patients who have received blood or organ transfusions prior to 1992. Children born to hepatitis C and positive mothers should also be tested, as well as patients who are infected with HIV. Anyone who is a sexual partner of a patient with intravenous drug use and other high-risk sexual behaviors should receive testing for hepatitis C virus infection. The U.S. Society of Preventive Service and Task Force also recommends testing patients with a history of intranasal drug use, patients who received unregulated tattoos, and also occupational percutaneous exposure. The baby boomers are people who were born between 1945 and 1965, and these account for 3/4 of patients with hepatitis C virus infection in the United States. And an estimated 35% of undiagnosed baby boomers with hepatitis C currently have advanced fibrosis or cirrhosis. Screening of baby boomers may prevent over 120,000 deaths due to hepatitis C virus infection. Screening in the primary care with this birth cohort would identify 86% of all undiagnosed cases, compared with 21% which would just be diagnosed with risk-based screening for hepatitis C. The cost effectiveness of hepatitis C screening is comparable to cervical cancer or cholesterol screening, such as the cost per quality of life years gained. So what are the barriers for testing in the primary care setting for hepatitis C? Frequently it's felt that the recommendation to test everyone born during this birth cohort may mean that too many people are being tested, and this is very expensive. One of the barriers is that clinicians often feel that they can identify patients who have clinically significant liver disease by their clinical presentation, and only will test patients at that point. Patients often will die with hepatitis C, not with their hepatitis C, not of it, and a lot of patients will be upset or harmed by undergoing through the hepatitis C testing algorithm to actually identify those few who may develop significant disease. Some primary care people feel that there may be nothing to do for hepatitis C, or are unsure that hepatitis C is curable, and are unclear as to the rapid advances that have been made over the last couple of years in the treatment of hepatitis C. Frequently, patients who are hepatitis C antibody positive may be presumed to have active infection, although, as we talked about earlier, that is not necessarily true. One of the major drawbacks for screening in the primary care setting at the present time is that there are already so many electronic medical record prompts for the physicians to follow through on that testing for hepatitis C just adds to that complexity. Typically, more women are tested for hepatitis C virus infection than men are, although the presence of active hepatitis C infection is more commonly found in men who are tested. So prevention of hepatitis C, it's important never to share any drug equipment such as straws, bills, needles, syringes, water, or filter. Never share any toothbrushes or razors or any personal hygiene articles that may have any blood amount on them, and also the practice of safe sex. Always make sure that new and sterilized equipment is being used prior to any tattooing or body piercing being performed, and also make sure that the ink for tattooing is not being shared between different customers. And you should not touch any dirty needles without proper equipment or following proper procedures. So with dirty needle precautions, you should handle these only if you have the proper equipment, such as a sturdy pair of gloves, tongs, or pliers, and a puncture-proof container. Place the needle in a puncture-proof container, and it's important to dispose of the container in garbage, but better if disposed in a needle exchange program or in a health clinic. If this occurs at school, it's important to notify the appropriate authorities. So at the present time in the United States, a very small percentage of patients who have underlying hepatitis C infection are actually undergoing treatment. If you look at all the patients who have a hepatitis C virus infection in the United States, about half of them have actually been diagnosed. Only a small percentage of them are actually referred for ongoing treatment, and a small number of patients actually receive treatment itself. Treatment does benefit all patients, so the AASLG and the Infectious Disease Society of America have guidelines that emphasize potential benefits and recommend treatment for all patients with hepatitis C virus infection. Urgent treatment is needed for people with advanced fibrosis and compensated cirrhosis, patients who have undergone liver transplantation, and patients who have extrahepatic manifestations of hepatitis C. Certainly, treating hepatitis C virus infection can reduce the transmission of hepatitis C, especially in women wishing to become pregnant, in patients on long-term hemodialysis, in men who have sex with men with high-risk sexual practices, in patients who are active intravenous drug users, and also in patients who have been incarcerated. The timing of hepatitis C therapy is controversial. It can be given at any time during the disease course and appears to work equally well in early disease as in advanced disease. With liver decompensation, the newer antiviral therapies may be of benefit, although those results are pending at this time. The hope is that by treating hepatitis C virus infection over the next 10 to 20 years, that we will be able to almost completely eradicate hepatitis C virus infection. It's hoped that about 90% of patients will be able to eradicate the virus by year 2030 once they have been identified. So in the old days, prior to 2014, there were multiple different factors that were involved in the decision as to whether to treat patients with hepatitis C. It would have depended on their age, the degree of elevation in their liver tests, the presence of extrahepatic signs of hepatitis C, what their personal plans were, the genotype, as well as the duration of infection, family support, as well as their occupation. The older therapies for hepatitis C were typically associated with various severe side effects which limited patients' ability to function on a day-to-day basis. Over the last couple of years, there's been a rapid development in newer medications for hepatitis C. Typically, we are now looking at simple regimens. And what are the key elements of an ideal regimen? Well, it should be simple, which means short duration. It should be an all-oral medication or medications. It should be highly effective, which means that it should work in various patients with hepatitis C, whether they have mild disease or advanced disease. The ease of dosing is important, as in less pills taken per day will obviously improve compliance with the treatment. Ideally, a pill that works across all different genotypes would be preferable, and hopefully the medication would have few side effects, or certainly side effects that were easily manageable. As you'll see here on the hepatitis C genome, there are multiple different sites of action for various different hepatitis C virus medications, and these have been the subject of numerous trials over the last 4 to 5 years. So how far are we at the present time? Well, we are almost there. We are in the midst of a medication being released soon where one pill will be available to treat all hepatitis C genotypes. Certainly treating hepatitis C virus infection does result in significant improvement in patients' liver disease, with significant reduction in all-cause mortality, reduction in the need for liver transplantation, as well as a marked reduction in the development of hepatocellular carcinoma. So the best way to reduce the likelihood that someone will develop severe complications of hepatitis C is to cure the infection. So I'd like to thank you very much for your attention, and I'm happy to answer any questions if anyone has any. Thank you.
So at this point, if anyone has any questions, they can type them in and email me for any questions, and this presentation will be available online as well. So we'll just wait 1 second to see if anyone has any questions. Thank you so much for the presentation, and this will be online and on your YouTube channel later today.
Okay, thank you.